Over the 5 decades that bioprosthetic valves have been commonly implanted, the frequency of superimposed thrombus has been thought to be pretty negligible. Now, is it uncommon or is it just unrecognized? So the title here from a JACC lineup in December 1, 2015 is Bioprosthetic Valve Thrombosis versus Structural Failure, Clinical and Echocardiographic Predictors, and I'm with Dr. Alexander Egbe, who is an MD, MPH from Mayo Clinic. Now, this is a hot topic right now. We know from a New England Journal article that's just been published online, but you obviously started this some time ago because you're publishing it in the December 1st issue of JACC. So you actually previously suggested that the presence of one specific finding could raise the suspicion of bioprosthetic valve thrombosis. So let's go back to that. What drove you to this study?
All right. Thank you very much for having me here. So going back to how it all started, this all started when in 2012 from Mayo Clinic, we published a series of 8 patients that had aortic valve bioprosthetic thrombosis. So this led up to a different study where we compared the response of people with presumed bioprosthetic valve thrombosis who received Coumadin compared to those that went for surgery, with the endpoint of determining efficacy, which is decreasing gradient, and safety. So that study showed that yes, some people do have bioprosthetic valve thrombosis, and they do respond to Coumadin, and the effect is non-inferior to surgery. So that led to the current study that's coming out in the next edition of JACC. In this study, we set out to answer 3 questions. How common is bioprosthetic valve thrombosis? The second question is, can we reliably make a diagnosis pre-op? And the third question is, at what time does it occur?
So let's go start those just in order.
Okay.
How common is it? It's been considered pretty rare.
Yes. So as we always say that the eyes cannot see what the mind does not know. So is it rare because it's rare, or is it rare because people don't recognize it? So what we did was that we looked at all explanted bioprosthetic valves in Mayo Clinic over a 17-year period. So there were 397 explanted prostheses. Wow. So we reviewed the pathology report, and 46 of them had thrombus on it. So what we did was a case control study comparing the 46 thrombosed valve to matched control that has structural degeneration. We did find that the prevalence of bioprosthetic valve thrombosis for all comers coming for valve explantation is about 11%, and that prevalence did not vary by valve position. So with regards to incidence, we tried to estimate it based on the number of prostheses implanted around that time, and the incidence is somewhere around 1 to 1.5%, but it's a very wide range. So that answered the first question of, is it common? Yes. 1 in 10 of explanted prostheses have thrombosis on them. The second thing is that we've always thought about thrombosis. If it happens, it has to be perioperatively. We found out that 65%, that's more than half of the thrombosis, occurred after 1 year post-implantation. So it's not a perioperative thing. The third question is, can we make the diagnosis? Yes, we can. We found out 5 risk factors. So the first one is increase in valve in the prosthesis gradient more than 50% within the first 5 years. The second risk factor is if there is increased thickness, which we define as having thickness more than 2 millimeters. The third risk factor is if there is abnormal leaflet motion. And the other 2 risk factors are clinical risk factors for people who have paroxysmal atrial fibrillation and people who are on Coumadin who have subtherapeutic INR. So presence of 3 of these 5 risk factors will reliably make the diagnosis with 70% sensitivity and more than 90% specificity. So we set out to answer those questions.
And we know from your previous work that you can treat it.
Yes, we know from our retrospective study that it can be treated, and that is what is leading to the 4th current study that is now, which is prospectively looking at the effect of Coumadin in treatment of bioprosthetic valve thrombosis.
Now, at TCT, I actually talked to Raj Makar, who is an MD at Cedars-Sinai in Los Angeles, and he's got the paper that was published the week before TCT in the New England Journal of Medicine, Possible Subclinical Leaflet Thrombosis in Bioprosthetic Aortic Valves. And that kind of shocked a lot of people. They actually had an entire press conference. They added at the last minute to TCT. So obviously, there is something there.
Yes. So it's a good thing that this is coming out now. So both for the percutaneous valve and for the surgically implanted valves. So both studies point out to the fact that bioprosthetic valve thrombosis is a real thing. It's not a diagnosis of exclusion. And what we just added to it is that for at least for the surgically implanted valves, that you can reliably make the diagnosis before sending them to surgery. And this has huge clinical implication because if you can make the diagnosis, treat these patients with Coumadin, you will save them going for surgery. And how does this impact the whole clinical practice? I don't know for now, but it's probably huge because the TAVR population is a population with more risk factors like atrial fibrillation and need for anticoagulation. So would this affect the guideline on how long you need to anticoagulate them? It's still too early to know.
So is the predominant mechanism of bioprosthetic valve dysfunction, is that really structural deterioration? Is that what you think is going on?
Yes. So based on the data that we have, yeah, it's predominantly due to structural degeneration, that in about 90%, but 10% of valves explanted have bioprosthetic valve thrombosis. It might look small, but if you look at the number of prostheses implanted in the United States alone, that's a whole lot of 10% of them being saved going for reoperation. And
it's now important that you actually think about it.
Yes.
Because it's been considered so rare in the past, it may not even be on radar.
Correct. So there are certain questions that still need to be answered.
Yeah, Dr. Egbe, that was the last thing. It is. That's exactly right. So where are we? What do we need?
So what we know so far is that bioprosthetic valve thrombosis is real. You can make the diagnosis. And from retrospective study, we know that they respond to Coumadin with about the same efficacy as surgery with no thromboembolic events or death based on small series. What we need to know now is how common is it in the general population with implanted valves? That's the incidence of it. That would be a study that will require a large prospective cohort to do, but that's important. And the next thing is raising the awareness so that clinicians will know that each time you're evaluating a dysfunctional bioprosthetic valve, you should always think, is this thrombus? Other questions that need to be answered is, how long do we really treat them with Coumadin? Right. So at Mayo Clinic, we treat them between 3 to 6 months. Is a very significant range. So the current study that we have, which is a prospective study, which will be out sometime early next year, is actually trying to look at the response time. Anecdotally, I think most people that will respond within 1 to 2 months. And finally, if they respond to Coumadin, what about the novel anticoagulants? These are all big questions that still need to be answered.
Well, as I said, we have the interview with Dr. Makar, who was at TCT. Please look for that. This is in the December 1st issue of JACC. And also, we have a cover story that covers TCT. We'll probably do a follow-up that will include this particular part of the story because it is certainly going on and it is certainly something that you need to consider. For Cardiol Source World News, I'm Executive Editor Rick McGuire.